You sit down to do one small thing, answer one email, wash one plate, read one page, and somehow 40 minutes later, you are frozen, not resting, not choosing, just locked there, watching yourself not move while a second voice starts building the case against you. Lazy, broken, dramatic, weak. That interpretation feels personal, moral even, but it usually is not. It is mechanical. What many people call the dark psychology of ADHD is not darkness in your character. It is what happens when a brain with impaired regulation is judged as if it were a brain with impaired intention. ADHD is not just distractibility, it is a disorder of executive function. The management system that starts, shifts, prioritizes, inhibits, and completes action. Think of it like the brain's control panel. The engine may work, the fuel may be there, but the switches do not fire in the right sequence. So why does it feel so shameful? Because the outside behavior looks deceptively simple. You missed the deadline. You forgot the call. You left the laundry in the machine again. Other people see the output. They do not see the friction. They do not feel the drag inside the system. And after enough years, you stop seeing it too. You only see the wreckage. This is where the self-help advice often goes wrong. Just be disciplined. Just try harder. Just build habits. If the problem were lack of caring, that might help. But ADHD often does not block desire. It blocks translation. You can care intensely and still fail to initiate. You can know exactly what matters and still not convert that knowledge into movement. That gap is where shame breeds. And shame is not passive. It changes behavior. When repeated failure pairs with criticism, your brain starts learning threat around tasks. Not danger in the dramatic sense, threat in the nervous system sense. Email becomes exposure. Cleaning becomes proof. Starting becomes a test you expect to fail. So you avoid, then delay, then numb out, then panic, then sprint. The cycle looks irrational from the outside. Internally, it is coherent. Your brain is trying to reduce pain in the short term. There is another layer. ADHD is strongly linked with reward processing differences, especially around dopamine, a neurotransmitter involved in motivation, anticipation, and salience. Salience means what feels important enough to act on now. In many ADHD brains, the signal for "this matters" is unreliable unless the task is novel, urgent, emotionally charged, or immediately rewarding. That is why you may be able to deep focus on one fascinating problem for hours, then fail to send a 2-minute form. It is not hypocrisy. It is uneven access to activation. Now add the dark part, not evil, hidden. If you grow up with undiagnosed or misunderstood ADHD, you often become a skilled actor in your own life. You learn to mask, meaning you build compensations to hide dysfunction. You over-prepare, over-apologize, use anxiety as fuel. Become the capable one in public and collapse in private. People praise the result and miss the cost. Then the identity splits. Outwardly competent, inwardly chaotic. So when you fail, you do not think, "My system needs support." You think, "They are about to find out who I really am." That is not insight. It is trauma flavored by executive dysfunction. What do you do with that? First, separate morality from mechanics. If a task is not starting, ask a better question. Not, "What is wrong with me?" Ask, "What part of the task has no handle?" Maybe the first step is vague. Maybe the reward is too distant. Maybe there are too many decisions packed into one action. Friction loves ambiguity. Second, shrink the activation cost. Do not tell yourself to clean the apartment. Open the trash bag. Do not tell yourself to write the report. Name the document. This is not babying yourself. It is reducing startup load so the control panel has fewer switches to flip at once. Small is not silly if small gets motion. Third, externalize what your brain does not hold consistently. Timers, visual lists, body doubling. Working near another person because borrowed structure helps sustain attention. Alarms that name the next action, not just the time. Take meds. Open laptop. Move laundry. Support is not a character indictment. It is scaffolding. Fourth, treat shame as a false narrator. When the inner voice says, if it mattered, you would do it, challenge it. Would you say that to someone with a limp who cannot sprint? Probably not. Impairment is not absolution from responsibility, but it does change the method. You still own your life. You just may need different machinery to run it. And finally, if this pattern is familiar, get assessed by a qualified professional. Not because a label fixes everything. It does not. But accurate naming reduces useless self-hatred. It lets you intervene at the right level. Behavior, environment, medication, therapy, skill building, instead of attacking your identity. You are not watching a weak person fail at simple life. You may be watching an unsupported nervous system hit the same faulty circuit again and again. That distinction matters because once the problem becomes visible, it also becomes workable. And that is where things start to change.